Earlier this year, America prepared for a tidal wave of contagion.
I think that when it got really real for us is when we started seeing what was happening in other parts of the world, and then when it started happening right here in our own country, we were thinking, oh, we better get really serious now.
For 30 years, this was the place where life began for so many. Then last February, Cone Health moved care for pregnant women to its main campus, leaving the brick and mortar bassinets empty on Green Valley Road.
And immediately, people who were looking at what was happening naturally started saying, what about the old women's hospital? You know, why don't we go that route?
All over the country, there are hospitals that are taking a small section of their hospital for COVID patients. We're fortunate enough to have an entire building.
Serendipity in the middle of the viral storm, but no time to enjoy the good fortune.
It took us about 5 years to plan to move our women's hospital campus, and it took us about 5 weeks to open this place back up.
It's really quite amazing how perfect this building is for what we need right now. So our intensive care unit, for example, is designed to hold up to 24 patients, but it was initially the neonatal intensive care unit. You've probably heard that before.
My son was in it.
Oh, really? Wow. And the thing that's fascinating about this is that unit was designed for mom to be able to be wheeled in her hospital bed to visit baby. And so because of that, we can now today fit adults in those pods where the NICU once was.
As important as a nearly ready-made building was, what Cone really needed was to raise an army of healthcare talent.
We put a call out, said, hey, who's willing to come help us? And we had over 200 people sign up.
Doctors, techs, and nurses like Kelly Duffy, who never hesitated to move to the new COVID-dedicated facility.
Because I knew that going there, one, I would be doing what I was called to do. And two, I knew that I would be protected.
Not just with all the PPE they could handle, but new and efficient protocols on how to use it.
We have someone that watches every move that they make to make sure that they don't contaminate themselves. And that's even more important when they're taking everything off.
These are the different masks.
For nurses like Cameron Howard,
I actually took care of one of the very first COVID patients at Cone.
coming to the new COVID-dedicated facility was never a question.
I was like, oh yeah, I'm coming over here. Because I knew I could make a difference over here. This is a pandemic. You don't get to live through pandemics.
The hope is that's what all these patients can say.
At the very beginning, when it all started, we were seeing a lot of older patients, you know, late 70s, 80s, 90s. And now that's not the case.
This building that was once known for where life began hopes to one day be known as the place where life was prolonged. Amanda Payne works in the ICU.
Yeah, I think that we all feel like we're lifelines for our patients.
Because you see the sickest of the sick.
We do, yeah. We take care of the sickest patients in our community. It seems to be that they hit a certain point and then they make a decision physically. It seems like they're where they get really, really sick or they start to get better.
And those times when they don't are devastating for everyone.
I mean, we've had devastating days where we've had multiple people pass in one day, and it's just, it takes a toll on you.